if I'm not able to touch my toes, what are the health implications of that? Does it set me up for risk of injury? Does it set me up to have pain? Or if I'm in pain, should I be able to touch my toes and that would be getting rid of the pain? It's thought to be this flexibility test that's added in to give us a picture of overall health, but does it really relate to that? Does the ability to touch your toes relate to your overall health and well-being? Prehabbers, welcome back to the Prehab Podcast. This is your host, Dr. Dillon Caswell. Today's episode is all about what limits your ability to touch your toes. So commonly, this is blamed on tight hamstrings. And in this episode, we're going to learn, is that true? Is the inability to touch your toes actually due to tight hamstrings, or is it potentially something else? It's a great episode. We hope you enjoy it. Today's show is sponsored by the Prehab app. This is not just an app, but a solution. You have the opportunity to take control of your rehab, prehab, fitness, and performance needs all from the palm of your hand. The app is available for download on the App Store for both Apple and Android users. Also, a free 7-day trial is available. Don't wait. Start taking control of your movement health today. Welcome back to the show. Today, we're going to take a trip down memory lane to start off that episode, thinking back to the physical fitness tests that you probably went through or maybe conducted back in grade school. Quick refresher, in case your memory said, I don't want to remember this, but it was the 60 seconds max sit-up, max pull-ups, shuttle run, mile run test, and then sit and reach. And then depending where you want, there may have been some other variations that have been added to it. But the physical fitness test in physical education, they've been conducted for years. They really started back in the early 1800s. And it received increasing national attention through the years for many good reasons. One is that for general health and to get a litmus test on what's the next generation's health status. The next reason was because the results of physical strength and power was thought to be correlated for readiness for combat if a war was to break out. So this has some serious ramifications if your nation is under testing compared to other nations, because then it shows weakness. And if weakness is shown, well, a nation might decide that they're going to plan a strike because the next generation's health isn't as robust as theirs may be. Due to that, after World War I and World War II, fitness testing gained a lot of attention from governmental agencies. In the 1950s, the heat on the fitness test really got turned up when President Eisenhower was in office, because the US wanted to keep up with the Soviet Union's advances in science, mathematics, and in physical fitness. Furthermore, around that same time, Hans Kraus and Sonia Weber of New York Presbyterian Hospital, they devised a fitness test in the 1940s. They tested it, got a lot of data, started to publish those results in the 1950s. Now, you may have heard of this test before. It's called the Kraus-Weber test, and it had 6 simple tests, took about 90 seconds to administer. What were those 6 tests? They were a simple sit-up with the knees bent and feet planted. 2 was a sit-up with your legs extended and not bent. 3, raising your feet while laying on your back. So they're really, really just brutalizing the core with these first 3. And then 4, raising the head, chest and shoulders off the ground while laying on your stomach. So think of a Superman, but only doing the top half of it. 5 was raising the legs off the ground while laying on the stomach. So now think of that Superman, but now your upper trunk is on the floor and your lower half, your hips are trying to extend up towards the ceiling. And then 6, with the knees straight, bend forward to touch the floor, which we're going to come back to that 6th test. But before we do that, you might be wondering, well, what were the results for Americans compared to European nations at the time? So here's the results from it. They tested 4,264 children in the United States and 2,870 in Austria, Italy, and Switzerland. The findings showed, to quote President Kennedy, despite our good food and our many playgrounds, despite our emphasis on school athletics, American youth lagged far behind Europeans in physical fitness. 57.9% of American children failed one or more of those 6 tests, while only 8.7% of the European youngsters failed. At the time, President Eisenhower was in office when this report came out, and it was termed the report that shook the president at the time, which really fueled him to then create the President's Council on Youth Fitness by executive order. Today's discussion is not any further on the nation's health and fitness testing history. It just provides some really good background, because what we're going to be talking about today is one aspect of that fitness test, number 6, that toe touch test. Standing up, leaning down towards the floor. Can you get your fingers to your toes, or can you get your hands to the ground? This is one that is commonly still administered. We get a lot of questions that come in on this specific test. So here's the questions that we're hoping to answer in this episode related to the toe touch. Should you be able to touch your toes? What are the health implications if you can't touch your toes? Is it really due to tight hamstrings? And if your goal is to be able to do this toe touch, we're going to give you some quick tips to help improve that toe touch. So let's jump into it, and let's provide a little bit more background on the toe touch test, because as you've already heard, this was derived from that Krause and Weber test. Now, what's more commonly used, at least in the physical fitness test, is a sit and reach test. This one was always one of my favorites in the physical fitness battery, not because I was necessarily good at it and had good posterior chain flexibility, but because I had really long arms. And my buddies, they would all struggle on this test. And because of my long arms, I didn't have to bend forward too much to get a really good score on that sit and reach test. But the sit and reach test was derived from the toe touch test. The sit and reach was thought to be a little bit more standardized and could decrease the fear of falling if one's balance is off, or they're afraid to lean down because they think that they're going to tip over. But anyways, the toe touch is commonly thought to be a test of flexibility, and specifically hamstring flexibility. The reality of this is that we should just say posterior chain flexibility, because that includes all the things from the back of the head all the way down the backside to the bottom of your feet. And any structure in there could potentially limit the ability to do this test. So the thought is that you should be able to touch the ground while keeping your legs straight. And if you can't, well, that means that your hamstrings are tight. This is the common thought that's out there, the common narrative on this particular test. We're going to dive into that discussion, but first, let's just answer this simple question. Should you be able to touch the floor during this toe touch maneuver? I'm going to give an answer that's really not popular and kind of aggravates people, but that answer is that it depends. What does it depend on? Well, let's provide some more examples to elaborate on that point. So should you be able to touch the floor? It depends. For example, if we have a runner, and any of the runners listening out there, they're going to be pumped about this one, or anyone that coaches runners, they'll be able to say, oh yeah, I've seen that a lot. But some research shows that having reduced hamstring flexibility actually becomes an advantage because it's thought to increase running economy. Now, on the flip side of that, research has not shown that if you increase flexibility, that will in turn decrease that running economy. But regardless, the takeaway is that sometimes having tight muscles that are specific to that sport can actually help in the performance of that particular activity. So if we have a runner, they have good running economy, they're not experiencing pain, we probably don't need them to be able to touch the floor in the toe touch. But another example on the flip side of this is of it depends, is if you're a performing artist or potentially in mixed martial arts, both of these sports require heavy core demands and flexibility demands. With that being said, it would be a good idea to be able to reach the floor during a toe touch to show that you have that flexibility. In that same conversation, I've been able to work with professional performing artists, actors, actresses that are out on tour. And it's amazing to see that these people can put their heads between their legs. They can lift their leg up where their knees near their shoulder and their calf is near their ear, and they still report that they feel like their hamstrings feel tight. So just a kind of a funny example there, a lot of people think they have limited hamstring flexibility, and it gives this perception of feeling tight. I've seen people in the world that have some of the highest levels of mobility still saying that it feels tight, another point that we'll come back to later in the episode. But the last example of it depends, although there could be many more, is if bending forward is painful, then your toe touch is going to be limited for good reasons. If going into flexion is bothersome, whether it be at the hamstrings, the proximal hamstrings, and its insertion point onto the ischial tuberosity up in that higher hip, or if it's in the lower back, well, then it may be a good idea to not push the toe touch, calm symptoms down, and then once symptoms are back down, now you can revisit that and see if there's been progress in it. So it depends. Should you be able to touch the floor? It depends on your goals. It depends on your activity. It depends on your symptoms. It depends on what you're feeling and how your system is behaving. So the next question then becomes, well, if I'm not able to touch my toes, what are the health implications of that? Does it set me up for risk of injury? Does it set me up to have pain? Or if I'm in pain, should I be able to touch my toes and that would be getting rid of the pain? And then lastly, kind of the third bucket is overall health, because it's thought to be this flexibility test that's added in to give us a picture of overall health. But does it really relate to that? Does the ability to touch your toes relate to your overall health and well-being? So we're going to take these two first categories, risk of injury and pain, and kind of put them together and just make the statement from what the research has shown that toe touch mobility has not been shown to be a causation for low back pain or hamstring injury. So once again, toe mobility has not been shown to be a causation for low back pain or hamstring injury. Toe touch mobility has also been shown not to directly change low back pain. If someone has low back pain, they have decreased ability to touch their toes. The ability to touch their toes hasn't been shown to change that low back pain once the person has it. And to give some research here on the other side of this, and it's going to sound confusing, but we'll try to kind of piece it apart to make it sound less confusing, because research from the British Journal of Sports Medicine in 2019 by Good, Cleveland, and Schwartz et al. Showed that trunk flexion was inversely associated with chronic low back pain and imaging findings of spinal osteoarthritis. What does this mean? It means that people that had a better ability to bend forward and touch their toes had less chronic back pain and back arthritis shown on imaging. But again, not back arthritis with symptoms. They had a large sample size, different subgroups. So again, that can be confusing. So let's go through it again. The inability to touch your toes is not a risk factor for back pain, and increasing it does not cause a direct decrease in back pain symptoms. However, those that are able to touch their toes at baseline were correlated to having less chronic pain and back arthritis. Still confused? That's okay. We're going to unpack this a bit further in a few minutes. But before that, I want to tie in another topic, because I think this topic will then help explain the topic that we were just chatting about. And this topic really started to blow up in 2009 when this research article came out. It was in the American Journal of Physiology of Heart. And it was, the lead author here was Yamamoto. It blew up. It got into New York Times, LA Times, and to all these different articles. What was that article? It was called Poor Trunk Flexibility is Associated with Arterial Stiffening. What is arterial stiffening, and what does this mean? Because in the context of what we're talking about, you may be thinking that it's the artery is now limiting the ability to do a forward bend. But arterial stiffness, the definition of, or what this does, is it's a significant measurement for predicting cardiovascular health. It increases with age as the vessels start to become a little bit less elastic and have the compliance of coming back. And it can have some negative consequences for the cardiovascular system, because it's a pressurized system. We have the heart, we have the ventricle that's pumping blood out through these tubes in our body. So it's a pressurized system. If the arteries become more stiff, meaning they're not able to expand as the heart is pumping blood throughout it, they become more stiff. It becomes higher pressurized, which then means that there's increased risk for higher blood pressure and hypertension, and then increasing size of the left ventricle, because now the left ventricle has to work harder to pump out more blood because of the resistance that is in this pressurized system. So arterial stiffness, it's important that we know what this is. But this research was done at the University of North Texas and then several Japanese universities. They recruited 526 healthy adults between the ages of 20 and 83, so pretty wide age range. And they had them perform the basic sit and reach test. So again, the toe touch test, but now they're sitting down and reaching forward. They then took the brachial ankle pulse wave velocity, which is a valid test to be able to determine arterial stiffening. What the researchers found was a clear correlation between inflexible bodies and inflexible arteries in subjects older than 40 years old. Adults with poor results or poorer results on the sit and reach test, they tended to have higher readings of arterial stiffness. So in short, the study concluded that a less flexible body indicates arterial stiffening, especially in middle age and older adults. What do we do with this info? Because Now it was kind of put out into the press and put out into the general public that you need to be able to touch your toes. And if you can't touch your toes, well, that is an indication that you could potentially have this cardiovascular disease or arterial stiffening. So for the benefits of health, you should be able to touch your toes. But in that, and I thought the researchers did a pretty good job of in their discussion of kind of talking about this, is that there's a lot of other factors that are involved. This was a correlation that was found. A lot of other factors. Well, what are those other factors? The stiffness of an artery is partly dependent on vascular tone of the artery. What is vascular tone? Well, it's the tone of the artery that's partially regulated by the autonomic nervous system, specifically the sympathetic nerve activity. So when you are stretching a skeletal muscle, this causes an increase in sympathetic nerve activity via the central nervous system. When you repetitively are stimulating this, that transient sympathetic excitation or increase in the sympathetic nervous system, it starts to become induced or decreased by habitual stretching exercises. So stretching, we did a whole podcast on this previously with Tommy Mandela, but we've learned that stretching does not change the muscle. It does not change the tendon, although there is some research showing that if you hold a stretch for really long periods of time, that it can actually have changes to it. But again, it's a very long time, and there's other ways that we can change the muscle or tendon. So when we're holding a stretch for 30 seconds, for a minute, up to 2 minutes, it's not changing the muscle. It's not changing the tendon. Range of motion is improving. So how is range of motion improving, but the muscle and the tendon aren't changing? It's due to the nervous system. The nervous system, its connection into the fascial tissue, its ability to want to protect the range because it's not sure if the body should be going into it. So the more that you do this, the more that you have graded exposure, the sympathetic nervous system, the protector system, starts to say, okay, let's take off the brakes. Let's allow you to move a little bit further into that. So with that being said, people that have habitually done stretching, whether it's through a yoga practice or just a daily flexibility type of routine, they generally are going to have a decreased excitation of the sympathetic nervous system compared to somebody who's not engaging in that practice. Now, with that being said, the person that has a little bit more flexibility because they have less sympathetic tone, they're allowing their brain's allowing their body to move a little bit more freely in these ranges of motion. They're going to have a decreased vascular tone, and by that have decreased arterial stiffening. So hopefully that helps to make a little bit more sense. You might also be wondering, well, what about the idea of chronic pain and osteoarthritis? And this is where we're also going to tie in this idea of the sympathetic nervous system and the inability to move through some ranges due to protection because of perception of threat. So chronic pain, osteoarthritis, we've done previous podcasts talking about how this idea of bone on bone doesn't really exist. Teriyama et al., they showed in a cadaver knee, when they applied static loads and tried to get the femur and the tibia, the thigh bone and the shin bone to be able to contact each other, they weren't able to do it. Now in a living system where there's more forces, there's more charges that are repelling each other, it becomes even harder for bone to be on top of each other. So yes, arthritis does exist. Spinal osteoarthritis, other arthritises in the body, it does exist. And there is a quote unquote wearing of the cartilage, but it's not because of the bones rubbing on each other. It's due to the inflammation that is in the system. Great example of this is that people think that an individual that's obese, that they're going to have arthritis because of the weight that their joints have to take on. And the reality, what the research has shown is that it's not the extra weight because their bones and body actually adapt to that weight. It's more the systematic inflammation that's causing the wear and tear on the joints. So with that being said, we can start to see, well, what creates this systematic inflammation and this continued inflammation? Because inflammation is needed for healing. It's the thing that kicks off the healing process. So we need inflammation, but it can become detrimental when that inflammation system keeps being turned on and it's not being turned off. It's just continuing to recycle. What's telling that inflammation, the inflammatory system, the immune system to do that? It's the sympathetic nervous system. So in people that have had this increased arterial stiffness, the less flexibility, we have to ask the question, well, what are the other states of their being? what's their sympathetic system, what's their parasympathetic system, and would they have the same results if they weren't doing a stretching program, but doing something else to deload that part of the nervous system that regulates so many things that are important. So hopefully that clears it up a little bit, gets you curious. You may have a lot more questions about it. And I would highly recommend diving into those research articles, listening to those previous podcasts we've done on what is chronic pain. Do our muscles, or should we actually be stretching with our muscles? And then the one on treating chronic pain, in which we dive into this bone on bone idea a little bit further. But we're going to keep this moving forward, and we're going to dive into this topic now. The inability to reach forward in the toe touch, it's not due to arterial stiffness. Like, arterial stiffness isn't limiting the ability to lean forward. But what people may think is that it's due to tight hamstrings. My hamstrings are tight, so I'm unable to reach down and touch my toes. Very rarely is this truly due to tight hamstrings. This is like, you're going to want to share this with people because it's so common. It's the number one thought. I can't touch my toes, so my hamstrings are tight. Very rarely is it due to that. More often, it is due to what we just talked about, that increased sympathetic tone, or the inability to complete a hip hinge due to motor control or motor patterning, or a combination of both of those. So how can you test for this? Because how do you know that it's the hamstring? How do you know it's the inability to hip hinge? How do you know it's more of a postural regulation activity? Very simply, typically we just do the toe touch test in standing. If you're unable to do it, we go, okay, unable to do that, tight hamstrings, check the box, move forward. But there's so much more information that we need to get from this, because when we're doing this in standing, the postural system, specifically the vestibulospinal tract, it has to send signals to now have postural regulation to be upright against gravity. And then moving forward, the vestibular system has to take in all this info that I'm moving through space. And if it's not getting accurate info, or it's not getting all the info that it wants to, it is going to limit the ability to do that toe touch. How do we start to decide, well, is it because of that postural regulation system, or is it due to a tight hamstring, which usually is not? Well, now let's do the toe touch in a sitting position. Why sitting position? Because the body now has less things it needs to worry about. The brain doesn't need to regulate all these different things that are going on into the body. So if you do it in sitting, and the person is now able to reach and touch their toes, and they weren't able to do that in standing, we cannot conclude that it was due to tight hamstrings. What we can conclude is that when their system is up against gravity, they don't have access to these motor control patterns or postural regulation to do a toe touch against gravity. So that means we're going to want to work on some core motor control, core patterning stuff in standing. Now, the main thing that we tend to see of what people need to be successful with this toe touch, again, if they have a goal of increasing their toe touch, is that they don't have the ability to do a hip hinge. What is a hip hinge? It's when your hips are coming back, your chest is coming forward. As people tend to get older, they lose that ability. We have to remember as providers that this is a balance strategy. We need a hip strategy to keep ourselves upright if we're going to potentially lose balance falling backwards. I go back to America's Funniest Home Videos, which is still on TV. I did not know this. We were out at a restaurant and I looked over at the TV and there's still America's Funniest Home Videos playing. Had no idea it was still on TV. I thought ridiculousness completely took that over. But America's Funniest Home Videos, I remember watching it as a kid and seeing some older adults losing their balance and just backpedaling for a long time, like maybe 50 feet before they could gather themselves. Now, what I've learned is that the reason that's happening is because they've lost the ability to shoot their hips back and have their chest come forward into a hip hinge. So as we get older, people tend to lose that ability to hip hinge. We teach them how to hip hinge, and you start to see that their toe touch actually dramatically can increase just by showing them that hip hinge pattern. A lot of different strategies that you can teach someone with a hip hinge. Not going to dive into that. We're going to keep the conversation going, because let's say that you do the toe touch in standing, you do it in sitting, and there doesn't tend to be a difference. Well, now we can start to look at it even further. We can now look at an active straight leg raise or a passive straight leg raise. So you lay on your back, you tuck your core tight, keep one leg straight or both legs straight, one on the table or the floor, lift the other one up as high as you can. How high does that leg go? Now, with the active straight leg raise, it doesn't give us much information. Is it due to tight hamstrings? So we have to now double it down with a passive straight leg raise, meaning that someone else is going to lift that leg for you. What we want to see is there a difference between the active and the passive straight leg raise? If there's not a notable difference, both of them are pretty limited, which tends to be this reference of less than 80 degrees. So if both of those are limited, well, now we can start to say something along this posterior chain from the hips down is restricting the ability to do a toe touch. If the active straight leg raise and passive straight leg raise are drastically different from each other, meaning that the active straight leg raise, they get to, let's say, 50 degrees, but the passive straight leg raise, they get to 90 degrees. Well, now we don't need to do stretching for the hamstring. We need to work more on motor control, or kind of this umbrella term, lower core work or stability, to be able to engage those muscles that would lift the leg, allowing the body to move forward. So this is how we can start to piece apart, is it really due to tight hamstrings? And then the next part is I want to share some quick tips that you can improve your toe touch with, because I do have a few clients that I've worked with in the past that this is now their party trick. They get together with their friends, whether it's a book club or a coffee date, and they just go, watch this. I can now touch my toes. I spent 45 years not thinking that I could touch my toes. I did these little quote unquote magic tricks, and now I'm able to touch my toes. So what are these magic tricks? You may have seen them on social media. You may see it and just be like, oh my gosh, how is this happening? This is quote unquote magic or a hallucination. But it really comes down to the neural system. So some of these magic tricks, you may have seen that someone's limited in their toe touch. So what they do is they provide light resistance to their forehead. They push into that resistance, meaning they're flexing their entire anterior chain. In doing this, they do it, then rest, and now they repeat the toe touch and they're able to do the toe touch. So people say that, like, oh my gosh, what's the relation to this? One thought is that you're activating the anterior muscles, which then would reciprocally inhibit the posterior muscles, meaning that the nervous system is saying, if I'm going to flex this side of my body, I need the opposing side to relax. And then in doing that, the toe touch is able to be improved because these muscles are now getting the signal to not hold tension, or the fascial tissue is given the signal to not have to protect this area. So that's one. Another one is that you can desensitize the posterior traveling nerve roots. These are the sciatic nerve and its branches that come off of it that branch down into the tibial nerve and then go to the bottom of the feet as the medial and lateral planar nerves. If you're limited in a toe touch, you can desensitize those nerves either by doing a nerve glide, which we talked about in a previous episode with Dr. Sharif Alnagar on neurodynamics. Another trick is that you can do a planar surface self-massage. So what is that? A lacrosse ball, rolling it along the arch of your foot on both sides, rolling it up your calf, maybe into the hamstrings, or you can just do it at the feet. Do that, desensitize the nerve roots, and then retest your ability to do the toe touch. So some quick magic trips that will help. And now if you do that and there's an increase, you know that it was from the nervous system, not from a tight hamstring. Last one that we've already talked about is the motor control. This is still related to the nervous system, but more movement related. Make sure you can do a hip hinge and make sure that you have the conditioning to be able to flex your lumbar spine. Some people that have had chronic low back pain, they really protect their back by these erectors, the glutes, all these muscles in the posterior chain. They're getting the signal that I don't trust the environment. I don't trust what's going on. So I'm going to contract these muscles to be able to protect it. So we need to make sure that that signal is being called off, the emergency brakes being taken off, and that the person can just flex their lumbar spine. Last point that we'll make with this is that if you are testing, if you're filming this on yourself to be able to look at your toe touch, do it showing your spine, because we want to see, is your lumbar spine, as you're doing this hip hinge, getting a nice curve to it, or is it staying really straight and the curve is coming from the mid back or your thoracic spine? We want that lumbar spine to actually be flexing as you're doing the toe touch. So make sure that you are training that ability to flex the spine, giving those mechanoreceptors rich information to allow the nervous system to say, we don't need to protect this anymore. There's not a threat. There's not damage. It is okay. We can allow more free movement. So wrapping up this episode, what are the keys that we want you to take away from this? Do not fuss over being able to touch your toes. Flexibility is on the hot seat to actually be retired from physical fitness testing, as it doesn't seem to be related to prediction of injury, or it doesn't seem to be a necessary component to decrease somebody that's having a pain response. At the same time, we shouldn't undermine the benefits that stretching could potentially have to decrease activation of the sympathetic nervous system. At the end of the day, if you want a new party trick, you can use some of these tips in this episode to get that toe touch. If your goals don't align with achieving a full toe touch, and you have other strategies that you can use to decrease the sympathetic load that you're potentially taking on, then you don't need to force a toe touch movement. Hoping you enjoyed that episode and were able to learn all about what restricts us from actually being able to touch our toes. And maybe you learned a new way to be able to do that and it can become your party trick. But let's go over the key takeaways from that episode. Key takeaway number 1, the ability to touch your toes or not touch your toes is not a risk factor for back or hamstring injury. Key takeaway number 2, if you're not able to touch your toes and you don't have a goal to do so, that is okay. You can get the health benefits of decreasing arterial stiffness through cardiovascular training, and there's plenty of other strategies that you can use to decrease sympathetic excitation. Key takeaway number 3, the inability to touch your toes is often quickly blamed on tight hamstrings, although this is very rarely the cause or limitation to be able to complete this movement. Prehabbers, thank you for listening. Thank you for commenting, subscribing, leaving reviews, and suggesting episodes that you want to learn more about, topics that you want to learn more about. All of this, all that you do, helps this podcast get to more and more people that are looking for solutions to be able to take control of their health. It's not possible without you and putting in those ratings, reviews, subscribing to the channel, subscribing to whatever listening platform you're listening on. And we can't thank you enough for being a part of this mission. All right, we'll talk soon.